I will discuss heart failure. I'll give just a general overview of heart failure. I'll discuss the definition, the symptoms, the risk factors, and how you can be screened for heart failure. So what is the job of the heart? The purpose of the heart is to pump blood throughout the body. And blood carries multiple little donut-shaped tiny red blood cells, which act like little cars, which carry oxygen. So when a normal heart is pumping strongly, it actually is delivering oxygen, blood, nutrients to all of the other organs in the body. So when a patient has heart failure, it doesn't mean that the heart has stopped and just completely is not working. No. Heart failure just means that the heart is not pumping as strongly as it should. So if the heart is not pumping as strongly as it should, then the other organs in the body are not getting that blood flow. They're not getting the nutrients. And so the other organs in the body can become sick. Also, if the heart is not pumping strongly, then you get a backup of blood, a backup of fluid, which can cause the lungs to be filled with fluid, the legs, and the other tissues. So that's just a general definition of heart failure. What are the symptoms of heart failure? So early on, most people have no symptoms. Early on in heart failure, you would have no symptoms. So that's why it's important to go to your doctor regularly, even if you're feeling healthy, even if you're feeling fine. But once you do develop symptoms, if you have heart failure, the symptoms can include swelling of the feet, the ankles, the legs. It can also include shortness of breath because the lungs can get filled with fluid. That's called pulmonary edema. You can be tired, you can be dizzy if you have heart failure. You can also have a heart that just races, a very fast heartbeat, even if you're at rest. Another symptom of heart failure is the inability to just lay down flat. You need to sleep sitting up on 2 pillows or 3 pillows, or some patients with really severe heart failure outright have to sit up in a chair to sleep because they're just too uncomfortable because the lungs get so filled with fluid. So that's another very serious symptom of heart failure. But again, early on, there are no symptoms usually, so make sure that you prioritize yourself and get checked to see if you have heart failure or risks for heart failure. So what are the risk factors for heart failure? Well, heart disease, as in if you've had a heart attack, then you're at risk for heart failure. If a doctor has told you that you have clogged heart arteries, then you're definitely at a big risk for heart failure. In fact, coronary atherosclerosis, which just means you have plaques blocking your arteries in the heart, that's the #1 cause of heart failure in the United States. Other risk factors are abnormal heart valves. So if you've been told that you have a stiff heart valve, for example, aortic stenosis, a stiff heart valve puts you at risk for heart failure. Also, if you have a loose valve, for example, mitral regurgitation, a leaky heart valve also puts you at risk for heart failure. Other risk factors, diabetes, hypertension, and a little known fact is that many infections can actually put you at risk for heart failure. HIV is one. So if you're a patient who has HIV that's poorly controlled and you have a high viral load and a low CD4 count, then it can cause you to have a big heart, not in a good way. It can cause you to have a dilated cardiomyopathy, which can lead to heart failure. Other risk factors for heart failure, stress. Stress can be a risk factor for heart failure for sure. Other risk factors for heart failure include obesity. The more overweight you are, the more work the heart has to do to meet your body's needs. So obesity is a risk factor for heart failure. Cocaine abuse, doing cocaine, doing crack, yes, that stresses the heart. That's a risk factor for heart failure as well. Cigarettes, tobacco abuse, specifically cigarette smoking, definitely increases your risk for heart failure. Another risk factor for heart failure is excessive alcohol use. And then here's a little known one as well, obstructive sleep apnea. What's obstructive sleep apnea? If you are a person who snores and the people around you tell you you snore very, very loudly, you call the hogs, and all of a sudden you stop breathing, there's silence, then you very likely have obstructive sleep apnea. Now, I know I'm talking to some patients, some of my own patients, who've been diagnosed with sleep apnea and who've been given the treatment, which is the CPAP machine. And there are many patients who do not like the CPAP machine. They say it's uncomfortable, it's blowing air in them, they can't sleep with them, the spouse doesn't like the big annoying CPAP machine. Well, obstructive sleep apnea, that snoring is not just a nuisance to people around or just something kind of funny, to laugh at for people who snore. It's very serious. Obstructive sleep apnea puts you at risk for heart failure. So it should be taken seriously. So those are the risk factors. So how can you be screened for heart failure or diagnosed with heart failure? Remember, you do not necessarily have symptoms early on, so it's important to go to your doctor regularly. And some of the tests that they'll do to see if you have the heart failure: one, an EKG, or an electrocardiogram. So this is that heart tracing that you'll often see on that paper that looks pink. That heart tracing can let your doctor know if you've had a heart attack. It can often let the doctor know if your heart is an abnormal size, or if one side is bigger than the other, and you have risk factors for heart failure. So EKG. Another thing, a simple chest x-ray. A chest x-ray can show if you have a backup of fluid in the lungs, pulmonary edema. It can show if the lung vessels are congested because the heart is not beating properly. It can also give us an idea of the heart size, if you have a big heart or a heart that really looks like it's at risk for heart failure. And then there's the echocardiogram. So what's an echocardiogram? It's an ultrasound of the heart. The same way that pregnant ladies get ultrasounds or sonograms of their bellies, you can get an ultrasound or a sonogram of the heart. And what the echocardiogram does is that it actually measures how strongly the heart is pumping. And it takes a good look at the heart valves. So if you have one of those stiff valves that puts you at risk, or a leaky valve that puts you at risk, the echocardiogram can help to pick that up. Also, some stress tests can help to pick up risk factors for heart failure. There's a blood test that can show you if you have heart failure as well. It's called the BNP, brain natriuretic peptide. And if this is elevated, then there's a high chance that you have heart failure. One more thing I do want to mention about heart failure and who's at risk: African Americans. The prevalence of heart failure is 25% higher in blacks. And younger patients with heart failure are more likely to be black than white. So again, if you are African American especially, don't wait for symptoms. Find out if you're one of these young people who's at risk for heart failure. What else can you do? What can you do to prevent heart failure? What should you be doing right now? Well, prioritize yourself. I cannot stress it enough. No matter how many people you take care of, no matter how many busy things you have to do, no matter how many jobs, no matter how many people are depending on you, I want you to pause and take care of yourself. Go to your doctor. Do that for you. Ask your doctor if you're at risk for heart disease or heart failure. Ask your doctor for a personalized diet and exercise plan. Make sure you have a low-salt diet. If you are obese, find out what a healthy weight is for you. Make sure that you have good blood pressure, good blood sugar. Find out if you have valvular heart disease. No matter what, in all things, it's so important. Go to your doctor. Make yourself a healthy, happy person. If you have any more questions about heart failure, please comment down below. This was just a general, really brief overview, but I can really delve into details about any portion of the heart failure. So let me know what you want to hear about. And even beyond the heart failure, let me know other topics you would like for me to discuss.